My name is Rachel Gunsalus, and I'm the co-president of the Public Health Student Association. I'm also a student in the Department of Health Policy and Management, so I recognize the power and the benefit that policy has in things related to prevention and other matters of public health concern. The Dickey Amendment was passed in 1996 by Congress, and this amendment effectively banned the Centers for Disease Control and Prevention from using any sort of funding towards gun violence research. So for the past 20 years, the CDC has been banned from collecting data on causes of gun violence as well as the best ways to prevent gun violence from happening in the United States. 30,000 people a year die from gun violence in the United States, and after the Sandy Hook shooting, I didn't think that we were ever going to be able to pass sound gun control policy if we couldn't do it at that moment in time. In light of the horrific acts this weekend in Orlando, an obvious hate crime that targeted LGBTQ persons, where dozens of lives were lost, the American Medical Association has adopted a formal policy where they are naming gun violence as a public health crisis, and they've also agreed to start actively lobbying Congress to overturn the Dickey Amendment that would allow the CDC to begin research on gun violence in the United States. They've agreed that enough is enough, and I hope that the horrendous acts this weekend can serve as the tipping point for the United States so that we can also agree that enough is enough and we're not going to have this happen anymore. Love is advocating for and working towards equitable policy that provides the same level of protections and rights to all persons.